Welcome to a new episode of our weekly web series, Science in Context. Recently, Think Global Health published a commentary on the economic cost of China's lasting COVID-0 strategy. I'm Roshni, and joining me this week is Professor Katharina Hauck. Katharina, can you tell me a little bit about the context in China?
We see that most countries could scale back non-pharmaceutical interventions against the background of increasing levels of immunity in their populations. Now, unfortunately, China is in a very different situation. Because of the history in the zero-COVID strategy, levels of infection-induced immunity are low. Vaccine uptake is low, particularly among the elderly, and also the domestically produced vaccines are less effective. Unfortunately, this strategy comes at very high economic and social costs for China. Quarterly growth for the second quarter was only 0.4%, the second lowest ever recorded. Growth projections for annual GDP growth were just revised downwards to 3.3, which is well below the government target of 5.5. So these costs are significant. Now we see in some other countries where the opposite strategy was followed, one with very little mitigation, resulted in an emergency situation of a lot of hospitalizations and many deaths. Of course, that resulted also in economic and social costs. This optimal strategy that policymakers are aiming for is one that is very difficult to achieve.
And what's, in your view, is the role of integrated modelling during a crisis?
So integrated models unify the often disparate advice that policymakers get from different academic camps. Epidemiologists advise on health impacts, social scientists on social and economic impacts. Over the last 2 years, we have seen great scientific advances in integrated modeling. And also here at Imperial, we have developed the data loss model, an integrated economic epidemiological model. So if and when the next pandemic happens, we should be in a much better place to advise on optimal policies.